Harmonic scalpel is an essential instrument nowadays. It is must having instrument. If you want to do the surgery properly, then harmonic scalpel should must be used. It is a ultrasonic energy and it's a mechanical energy which has a 55,500 vibration per second. And harmonic scalpel disrupt hydrogen bond and then it forms a coagulum. Harmonic scalpel is not a current, it's not a monopolar, it's a friction energy. It has a very interesting history that one of the gynecologists was doing the vaginal ultrasound of one of the patient, and this patient was suddenly jumped and it was transducer was broken, and once it was broken then she called the company people and she said that your ultrasound probe is burning. Then company people they saw very carefully and they said that madam you have put piezoelectric crystal upside down because it was broken and you try to fix it yourself. So this piezoelectric crystal is touching and that's why it is burning. Then she said that then what to do, you have to buy a new one. Then she said that okay, I will buy a new one but old one I will keep with me. And then she attached one screw here. If you will see very carefully, one screw is attached here. Look at this screw. And you will attach anything in this screw that will vibrate. Because there is a principle of piezoelectric crystal that if you will put a current over the piezoelectric crystal, it will vibrate at 55,000 vibration. Piezoelectric crystal is in your watch also. Piezoelectric crystal is used in quartz crystal also. It is used in the computer also. So piezoelectric crystal is a quartz crystal which has a tendency to vibrate if you will put current over that. So there is piezoelectric crystal inside, and once current come here it vibrates, and anything you will attach to the piezoelectric crystal it vibrates. Your ultrasound machine also has a transducer, has a piezoelectric crystal. But we are using only sound part of that piezoelectric crystal to do ultrasound, but here we are using mechanical part of that piezoelectric crystal. And in this screw you can attach anything. You can attach the hook. This is harmonic hook and I have attached it. And you can see here it is like a hook, simple hook, and you can do for cholecystectomy, colpotomy, partial nephrectomy. This is harmonic hook, very useful. Then you have a harmonic ball, harmonic shear, harmonic ace, harmonic wave. This is the harmonic ball. This is my favorite instrument to do the endometrioma surgery, and we do endometrioma with the harmonic ball. This is a beautiful ball which does a very good fulguration, and it can be without any damage of the ovarian cortex. You can do endometrioma. It can be also used for preventing the liver bleeding from after cholecystectomy. I will show you how to use harmonic ball. So see this endometrioma. I will take a little forward first and look at this here. So what is done, that it is an unmarried girl, it is opened and it was not having a true cystic wall. So you will put 1 ml hydrogen peroxide, and this is 1 ml hydrogen peroxide. Just after suction of all the chocolate material it is opened, and after that just this is harmonic ball, and you will move all around. See, it is doing the job, and this is harmonic ball, and that's all. And you cannot see any smoke. Do you know what you are seeing is what? Vapor bhi nahi hai. What is this? This is a spray. I will show you that spray, how it works. And then this is a 1 ml, yes, hydrogen peroxide. Hydrogen peroxide nowadays recommended, I will show you, H2O2 for endometrioma. So recently there are many literature where hydrogen peroxide is used for laparoscopic treatment of endometrioma. So you will put just 1 ml hydrogen peroxide and after that you can coagulate it. So H2O2 is used for treating it. So this way you can do this ablation. So this is a beautiful, a lot of devices are present which you can use. Like here, this is the harmonic wave. Harmonic wave. If you want NDVH, then you can use it. And same transducer will be attached here also. This is the transducer and you will tighten it. And after tightening, this is tightener. So you 2 times you have to tighten. 1 and 2 and it's done. And after that you can do NDVH. Here it is called minimum and maximum. In minimum, frequency will be only 15,000 to 35,000 and maximum frequency is 55,000. So maximum is used for cutting, minimum is used for coagulation. This is harmonic ACE. Harmonic ACE is used for laparoscopy. Here, this one. And this you will attach and then you tighten it. And once you tighten, then again this is 1, 2 times it is tightened. Now you can see this is the machine. In the machine you will see, once you will turn on, there are many machines like Gen 300, Gen 11, many machines are there. This is machine Gen 300. And then you will turn it on and this machine you will put it there and then you start. And here you can see this minimum you can use at 1 also. At 1 vibration will be 15,000, at 2 vibration 25, and 3 35, 4 45 and 5 55. But there is no point putting 5 because 5 is already there in the maximum. So it should be put 3, 1 or 3. So here it is done. After that you will test it. How to test? Keep the jaw open and press. And it is testing. And now it will show that machine is okay. That means testing is passed. Your machine is working. Now I can show you here that I am putting my finger here. And see, my finger is touching here. And then I will activate, but my finger will not burn. Because I am touching the Teflon jaw. Look at this. Press. And see, my finger is not burning. Even if I will touch here, my head is not burning, your skin is not burning, because nothing will burn. But I will tell you that this finger, keep on pressing and then see, together with my finger, I am putting inside and then see. It is spraying the water. Do you see? And my finger is not burning. Press here and it is not burning. And if you see, it is cold, completely cold, no heat is there completely. Why? Because if anything doesn't touches, it cannot become hot. Just like you have a knife and you keep on moving in the air, it will not become hot. But once you cut anything, it may become hot because of friction. So right now, if it is not touching, it is completely cold. And why my finger was not getting damaged? Because I was holding the Teflon jaw. And this Teflon jaw is of no use. This moving jaw is called Teflon jaw. Moving jaw has only one purpose, to bring the tissue near the vibrating jaw. That's all. And you can use it even for, suppose you want to do colpotomy. Then you don't have to close the jaw. And only by the open jaw you can do colpotomy. See here, it is cutting the vagina. And no smoke you can see. No smoke. And it is cutting. And only one jaw, I am keeping it open. And it is done. And jaw was open. If I want to do partial nephrectomy, you can cut the kidney. You want to do cholecystectomy, at those you don't have to close. You want ovarian drilling, you can press it like that and it is doing the drilling. You want to cut the tube, salpingotomy, you can cut the tube like straight like that tube is cut and it is splitted. You can see it is longitudinally cut. It is cut. So basically it is a scalpel. Name is what? Harmonic scalpel. It is a friction energy and it is a very good cutter. And remember, if you use harmonic, you can remove your monopolar from the OT, because it will do all the job which your monopolar does. That it can cut, it can blend, it can even fulgurate. Once you have a bleeding, go and touch the bleeder, it will give you the friction energy, rubbing over. And it can seal the vessel up to 5 mm. Like suppose we have made a 5 mm vessel, like here, and you go and slowly it will seal. And you can see this vessel is sealed. And then even if you will put the fluid inside, it will not leak. It is sealed, and you put the fluid, it is watertight. It will not leak. And up to 5 mm of the vessel it can seal. And see, even I want to milk it, it is not leaking at all, and it is sealed. So harmonic, in my opinion, is must having instrument. If you use harmonic scalpel, you can eliminate all these problems of the remote injury, collateral damage. It only creates 2 mm collateral damage. And while it is cutting, it is coagulating also. So it's a versatile instrument. And you will ask, this is the handpiece. Handpiece has a transducer. And there are a lot of instruments which is available. Here we can see this is harmonic ace. This is Teflon jaw and this is vibrating jaw. What it happens mechanically, once it vibrates, just like when you vibrate your both the hand, then what happens? Friction will create heat. Once we are rubbing both the hand, heat is producing. Same way it works because of friction energy. And absolutely no current is flowing through the instrument. Current is only in the machine, it is not in the instrument. Instrument what has a vibration, and this vibration always keep Teflon jaw towards the delicate structure. Like suppose you have the artery, keep the Teflon jaw towards the artery, so that even if it touches, it doesn't, it is inactive jaw. Just like in cholecystectomy, when we cut the peritoneum, we keep Teflon jaw towards the gallbladder, so that gallbladder will not puncture. This is the vibrating jaw. It has an adaptive tissue technology. What does that mean? According to the power of the tissue, it increases its force. Like hard tissue, it increases its power, and the soft tissue, it remains less power. So this is the vibrating jaw, metal jaw. And harmonic is nowadays is essential instrument. Good thing about that, many Indian companies are also making now ultrasonic dissector, and those are like Om Surgical, Lotus is another company, Indian company, and for those companies you can buy it from 4 lakh rupees only. Original Ethicon is costing you around 18 lakh rupees. But Indian companies for 4 lakh rupees you can buy. In the Ethicon, do you know one hand instrument costs you 45,000 rupees. In Indian company, one instrument costs you only 20,000 rupees. And 20,000 you can minimum use 20 times. So it is affordable now. If you will buy a good generator, that also will cost you 4-5 lakh rupees. You will buy from a good company. So why to buy the monopolar, bipolar? Why not to buy the harmonic? But harmonic also can create some complication. One of the complication here, can you tell me what is the mistake here surgeon is doing? नहीं, यहाँ पर number 1 में he is stretching. Remember, I told you earlier that any tissue which is under a stretch cannot seal, and it will bleed because before cutting coagulation it cuts. So a stretching of the vessel is not required. Like if you are coagulating cystic artery with the harmonic, you should relax the Hartmann pouch, or renal artery or splenic artery, you should relax, then only it will seal. What is the mistake here? partially holding, so it will bleed. What is the mistake here? Yes, upside down. If it is like this, is called knocking effect of harmonic. It give you knocking, just like if you want to put a mirror on the wall and you want a drill machine to put a screw and that drill will touch the glass of the mirror, your glass will break. The same way, this, what should be the correct way? Upside down. This should be up, this should be down. Just like my finger was touching the Teflon jaw, then it was not burning. So this is also the mistake, is that it should be down, this should be up. So these are the only few mistakes which you will not do with the harmonic, then there will be no complication.